Now, it seems that every second day there's some sort of example of a public servant or a government body or a politician or a lobby group who is trying to change the way that all of us like to live our lives. Now, sometimes these can be changes for the better, but more often than not, they're just little irritations along the way. And then sometimes they are so ridiculous that they need to be shamed and need to make sure that whoever was behind them is put back in their box. A perfect example of this has happened on the north coast of New South Wales. In fact, the Northern Area Health Service has released an email and sent an email to not only all of its staff in a variety of hospitals, including doctors and nurses, but also all health professionals who have anything to do with healthcare on the north coast of New South Wales. The email says that they should refrain from using terms like darling and mate when referring to patients. Now, I want to make sure that I get this 100% correct here, but supposedly the reason, according to this email that was sent to everyone, that mate, darling and sweetheart were, quote, disrespectful, disempowering and non-professional. Well, I've got a word for the people who sent that email out. What a wank. Seriously, are we honestly that bereft of things to do that this is the email that has to go out? Of all of the things in a regional area of this country to do with healthcare, this is honestly the thing that needed to be done? And why did this take place in the first place? Well, because somebody complained. Now, I'm getting tired of this. Just because somebody has a complaint doesn't mean that it is valid. It doesn't mean that something has to be done. Perhaps maybe the way that this could have been dealt with is thanks very much for your complaint and throw it in the bin. Who would feel disempowered? And who would think that a nurse is unprofessional for calling you sweetheart or darling or mate? After all, nurses in particular, and particularly ones working in regional areas, have got a very tough job. And the bedside manner of many people who work in our health industry, well, that's the difference between a positive stay and a bloody awful one. Now, I understand that medicine is all about being clinical, but the language doesn't have to be clinical. The interactions with the people who are taking care of you does not have to be clinical. And shame on the person, firstly, who complained. Get over yourself. And secondly, to the person who thought that it was a valid complaint and one that we needed to send out an all-staff email on. But then conversely, when this issue was raised today by the media, the New South Wales Premier, Barry O'Farrell, strangely didn't have the reaction that you're having right now, the reaction that I have had since hearing about this today. He seemed to have more problems, not with the words sweetheart and darling, but more so with the word mate. In a press conference today, Barry O'Farrell went on to say, among other things, that he's not going to come down hard on anyone who is trying to make a government area and a government bureaucracy become more professional. This is not an example of someone trying to make the bureaucracy more professional. This is an example of massive overreach. And if we have nurses and doctors and ward staff second-guessing whether they call someone darling or sweetheart or mate, there is a whole lot more wrong with the health system in New South Wales and with us generally than just whether or not people feel disempowered by the nurse who is treating them. Get over yourself, the person who complained, and reverse this decision immediately.